The job description of a medical secretary involves providing critical administrative and clerical support in healthcare settings such as hospitals, clinics, private practices, and diagnostic centers. A medical secretary serves as the organizational backbone of medical offices, ensuring that operations run smoothly while maintaining a patient-centered environment. By handling scheduling, correspondence, record-keeping, and communication between patients and healthcare providers, medical secretaries make it possible for doctors and nurses to focus on delivering care. Medical secretaries are the first point of contact for patients either in person or over the phone. Their duties require them to balance compassion with efficiency as they manage appointments, maintain medical records, and process billing or insurance documentation. In essence, they serve as a bridge between clinical staff and administrative processes, helping maintain the integrity, privacy, and accessibility of medical information. This administrative role demands excellent interpersonal skills, a firm grasp of medical terminology, and a working knowledge of healthcare regulations such as HIPAA. While the tasks may appear behind the scenes, the work of a medical secretary has a direct impact on the quality of care patients receive and the operational efficiency of healthcare facilities. Core responsibilities of a medical secretary. The fundamental responsibility of a medical secretary is to ensure the orderly flow of information and coordination within a healthcare facility. One of their primary duties is to manage appointment schedules for one or more physicians or specialists. This includes booking consultations, confirming visits, managing cancellations, and minimizing scheduling conflicts to keep patient care timely and organized. Medical secretaries also maintain patient records, a task that involves filing, retrieving, updating, and safeguarding confidential health information. With the shift toward digital systems, many secretaries now use electronic health record (EHR) software to input and manage data, often requiring accuracy, attention to detail, and digital literacy. Reception and front desk duties are integral to the role. A medical secretary often greets patients, collects registration forms, answers phones, responds to emails, and provides directions or assistance as needed. They also ensure that waiting rooms are organized, informative materials are available, and that a calm, welcoming environment is maintained. Communication is another key responsibility. Medical secretaries relay information between patients and medical staff, whether it's reporting symptoms, rescheduling appointments, or forwarding test results. They also correspond with external institutions such as insurance companies, laboratories, and pharmacies to facilitate referrals, prescriptions, and reimbursements. Administrative and financial tasks also fall under a medical secretary's duties. These include billing patients, processing insurance claims, managing petty cash, ordering supplies, and preparing financial reports for office management. In smaller practices, the medical secretary may be responsible for payroll records or bookkeeping, requiring basic accounting knowledge. Midway through examining their various duties, it becomes clear that the job description of a medical secretary covers far more than mere clerical work. It combines healthcare knowledge, administrative competence, and interpersonal finesse to ensure seamless care delivery. Essential skills and qualities for the role. Success in the role of a medical secretary depends on a wide range of skills. Foremost among them is communication. Because they interact with patients who may be in distress, anxious, or dealing with sensitive issues, medical secretaries must communicate with empathy, patience, and clarity. They also need to relay technical information accurately between healthcare professionals. Organizational skills are vital, as the role requires juggling multiple responsibilities, from appointment scheduling to managing documentation. Medical secretaries must be adept at prioritizing tasks and ensuring that no detail, however small, is overlooked. A well-organized secretary contributes directly to the efficiency and reputation of the medical facility. Attention to detail cannot be overstated. Inputting incorrect patient data or misfiling records can have serious consequences for patient care. Therefore, precision in data entry, spelling, coding, and document handling is essential. Familiarity with medical terminology and procedures is another core competency. Understanding terms like hypertension, echocardiogram, or biopsy allows the secretary to comprehend physician notes, fill out accurate paperwork, and communicate effectively with clinical staff. In many cases, medical secretaries receive formal training in this area. Computer proficiency is necessary for using office software, EHR systems, billing platforms, and communication tools. Medical secretaries should be comfortable with word processing, spreadsheet creation, database navigation, and digital communication platforms. Familiarity with software like Microsoft Office, Metasoft, or Epic systems can be advantageous. Discretion and confidentiality are fundamental, especially given the sensitive nature of medical records and patient information. Medical secretaries must uphold legal and ethical standards at all times, complying with data protection laws and maintaining strict confidentiality. Time management and multitasking abilities allow secretaries to perform efficiently in high-pressure environments where multiple demands often arise simultaneously. They must be able to switch from answering phones to filing paperwork to interacting with patients without losing focus. Work environment and common challenges. Medical secretaries typically work in clinical environments such as hospitals, private practices, dental offices, and outpatient clinics. They are usually based in reception areas or administrative offices where they handle a steady flow of phone calls, emails, and walk-in inquiries. The work schedule often aligns with the facility's hours of operation, which may include weekends or evenings, especially in urgent care centers or hospitals with extended hours. Some secretaries work part-time, while others hold full-time positions with benefits. While the role is largely sedentary, it can be mentally demanding. Medical secretaries must deal with upset or confused patients, urgent scheduling issues, and complex insurance queries. They often serve as a calming presence during emotionally charged situations. Other challenges include staying up to date with evolving healthcare software, regulatory changes, and coding systems. Medical secretaries are also under pressure to maintain accuracy and speed, especially in fast-paced settings where errors can delay care or billing processes. Despite the demands, many find the work deeply rewarding. Medical secretaries often develop close relationships with patients and become trusted points of contact. They also gain satisfaction from contributing to a greater purpose, supporting healthcare providers in improving and saving lives. By this stage, it's evident that the job description of a medical secretary is dynamic and impactful, demanding a well-rounded professional capable of blending administrative rigor with human-centered care. Education and career development. The educational path to becoming a medical secretary typically begins with a high school diploma, followed by specialized training in medical office administration. Many vocational schools, community colleges, and online programs offer certificates or associate degrees in this field, covering medical terminology, transcription, billing, office procedures, and healthcare laws. Certifications such as Certified Medical Administrative Assistant, CMAA, or Certified Medical Secretary, CMS, can enhance a candidate's credentials and improve job prospects. These certifications often require passing an exam and completing continuing education to stay current. Some employers offer on-the-job training, especially for entry-level roles. However, experience in healthcare settings, familiarity with EHR systems, and strong customer service skills can fast-track advancement. Over time, medical secretaries may move into supervisory roles, office management, or specialized administrative support within departments like radiology, oncology, or pediatrics. For those interested in further advancement, additional education in healthcare administration or business management can open doors to practice management, hospital administration, or billing specialist positions. Conclusion. The job description of a medical secretary outlines a vital role at the intersection of healthcare and administration. These professionals are responsible for ensuring the smooth operation of medical facilities by managing schedules, maintaining records, handling communication, and supporting both patients and clinical staff. With a unique mix of empathy, precision, and efficiency, medical secretaries help uphold the quality and reliability of patient care from the front desk. For individuals who thrive in structured, service-oriented environments and want to be part of the healthcare industry, this role offers long-term stability, purpose, and professional growth.